Let's bring in our good friend, Dr. Joe Congeni, Akron Children's Hospital Sports Medicine Center with us. Good morning, Joe, my friend. How are you?
Great, Ray. How are you doing today?
I'm doing really well, my friend. What do you have for us today?
Well, the puzzle in sports medicine, the head scratcher in sports medicine centers around Cleveland again, and it has to do with the NFL draft. It came off pretty well, but a lot of people really feeling like the Browns got a steal, getting a very highly regarded football player from the University of Notre Dame. And then it comes out a couple days later that perhaps part of the reason that he slipped all the way to the 52nd pick, around 15 or 16 or 18, is that there may have been a question about his heart evaluation, his screening for his heart evaluation. Could he be at some risk medically? And so I wanted to talk a little bit about screening heart problems and particularly maybe about what we know about this case. A lot we don't know. They haven't mentioned anything at all about what it was that perhaps they found. But what they have mentioned is a complete evaluation by the Cleveland medical staff. It seems to show that he's totally cleared and is going to be fine to play. That leaves a lot of people really shaking their head. How could, at the very, very highest level of the NFL, how could a lot of people still have had question marks on the night of the draft about his heart? And so I'll explain maybe a little bit about how that could happen. Screening athletes for heart disease is really a challenging problem. And you know, Ray, that we do this all the way down to the high school and pre-high school level. When kids play sport, they get a physical examination. And an important part of that physical examination is the heart screening. In the high school and pre-high school level, the heart screening is typically what's just called a clinical examination. In other words, questions about the heart history and then listening with the stethoscope to see if we hear anything abnormal in the heart that would have us have to study that person more. And one of the things that we see when we do that, of course, always this is a good time at the heart check to make sure that we pick up if anybody would have high blood pressure. So we do a blood pressure check. We listen, and one of the things that's a little bit difficult is some kids have a thing called a murmur. And a murmur is an abnormal sound in the heart, sometimes created by narrowing of some of the major arteries and vessels coming off the heart. And as many as 30% of young athletes will have murmurs when we do that examination. But luckily and thankfully, the vast majority of those murmurs are what are called innocent murmurs or functional murmurs. And a big job of medical people in the high school setting, in the sports medicine setting, is making sure that these people with murmurs don't have abnormalities that could be pathologic or put them at risk. The ones that would put an athlete at risk are thought to be less than 5%. Some studies that I looked at last night said even less than 1% of these abnormal murmurs or sounds in the heart. So again, about 30% of kids have murmurs. About less than 5% have anything with a murmur that could put a kid at risk. So something like murmurs are confusing sometimes in high school kids and junior high kids. I wouldn't believe that that would be an issue in a major college or professional player. So the next step is, as we get to college, as we get to the professional level, you know that I've told you several times, there's about 30 million kids that play youth sports in this country. So we just can't do a lot of the fancier, more expensive studies. There's about 8 million kids that play high school athletes. There's about 450,000 that play college. So when we get to the college level, when we get to looking at the professional level, we often move on to further testing to try to make sure that the heart screening is not a heart problem that could put an athlete at risk. And the two tests that are added sometimes, most of the time, number one is the EKG. And the electrocardiogram, the EKG, looks at the electrical activity of the heart. And when there's abnormalities in the electrical activity of the heart may not beat normally, especially under the rigors of sports. And so some people with heart abnormalities have to be checked out further. Some people with bad heart abnormalities have to be told they can't play because they're at risk. And so EKG is one thing that's usually done. The other is called an echo type test. An echo test looks at the structure of the heart. It looks at the chambers of the heart and the major vessels that come off the heart, like the aorta and other major vessels of the heart. And so those are two tests that are done very routinely at a place like the Combine. So at the Combine every year when they're trying to decide with NFL football players, many teams will all do their own cardiac evaluation, heart evaluation. And one of the things that I heard this year is that, of course, with the virtual year, they did not have the Combine. And so teams were not as able to do as much extensive testing. And so that maybe they were left with more medical question marks on an orthopedic side as well as the heart side and other areas, is because there was no Combine, they were not able to do as extensive testing. And some of the rumors going around were that there was a question about the heart testing of JOK, Jeremiah Owusu-Karamoah, and that the teams just were a little bit nervous about that because they didn't have the Combine, they didn't have the extensive testing, and something that was picked up might have put them at risk. Let me tell you one final area that is sometimes confusing in this cardiac screening, heart screening, is that about somewhere around 8% to 10% of athletes that are very serious athletes have a thing called athlete's heart. And as the heart and these athletes are very well trained, there's a physiological adaptation to the heart to exercise. And there can be, for instance, enlargement or abnormalities in heart rhythms. And there's a thing that came out for us in sports medicine in 2012 called the Seattle criteria. And there's many things that people with athlete's heart, athletic heart syndrome, that are maybe abnormal in other normal people, but in athletes it's not abnormal. It does not put an athlete at risk. And I'm suspicious that may be what was the case here. Some of these are not as easy to sort out, but some of these things in the really well-trained heart that might be abnormal in somebody else are not abnormal in an athlete, and that may have been part of what led to JOK being questioned as a possible heart problem. People also have looked and said maybe he was a little bit shorter. He didn't run the 40-yard dash because of injury. And so there's other issues people have said. But a lot of that, what caused him to slip so far in the draft, was this question mark about the heart, and perhaps because teams just didn't get as much time to do evaluations in depth on his heart, that may have led to part of the reason why people had question marks on the night of the draft when it came to his heart history.
Really good explanation. Thank you, Joe. Terrific insight, my friend. We'll catch back up with you next Wednesday. Thanks, Joe.
Sounds good. Have a great week, Ray.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center, getting into the world of sports medicine in regards to the Browns and their NFL draft.